Good afternoon, everybody. Assalamu alaikum. I think we can start with the word Ramadan Kareem. And we have 2 to 3 resource sessions for embryology in the block of head and neck. I'll go through slowly so that the important concepts are very clear to you. Obviously, don't forget me. I'm Dr. Paul Ganguly. You know me for a long time. I was away for some time, but I'm back. I'm physically in my office right now, so it's a nice feeling that I'm talking directly to you from Riyadh itself. It's always a pleasure talking to you. So I start with the objective with the pharyngeal apparatus, face, and the palate. It looks a little difficult when you open the textbook, but stay with me as usual. I'll make it very simple. And at the end of the dissociation, you will understand quite a bit. I'll repeat it later in a review session, but for the time being, try to be with me, please. And most of the slides are taken from the Langman's Embryology, Moore and Prasad. That's your textbook, if you have that. And some aspects I have taken from the internet itself. It's sometimes the students feel this is an international problem. They think the pharyngeal apparatus and development of face is extremely difficult. But trust me, it will be okay. So I request all of you to follow carefully my resource, which will be 2 to 3 times in relation to the pharyngeal apparatus and the face and the palate. So why are you learning pharyngeal apparatus? Obviously, you say that, Dr. Paul, we have to pass the exam. Yes, that's true. But at the same time, you have to know the origin of structures at the head and neck. They're coming from where? How do they look like? How do they look like? Such as nerves, muscles, cartilage, ligaments, and glands. Where are they placed? How are they placed? Why they are placed where they should be? It all comes to the embryology understanding. And it's a very simple concept, very interesting. So I hope I will fulfill my mission. And the other reasons are some clinical aspects, bronchial sinuses or fistula or cyst is very common, not uncommon. By the side of the neck, you may see somebody may have swelling, not in the midline. Midline is usually thyroid, related to thyroid, midline. But if I'm talking the sidewise, which I'm going to talk today more on that, is the pharyngeal sinus or fistula, the cyst or bronchial sinus people call. It's very common. I will show you later. The first arch syndrome, what do you mean by first arch, second arch, third arch, like that? The syndrome is always a symptom complex. So it will affect many things. So I'm coming to that. It's not very uncommon. A child is born with first arch syndrome. So you have to know. So at the end of the research session, you will understand that. What do you mean by first arch, second arch, like that? DiGeorge syndrome. It is a congenital thymic aplasia. Everybody knows by now, thymus is the immunologic gland in the early part of life. But if it is absent, including the parathyroid gland, we call DiGeorge syndrome. A child is born with calcium problem and immunologic problem. Very likely it is a DiGeorge syndrome. And what is this all about? I'm going to explain to that today. Thyroglossal cyst is a midline swelling. Thyroglossal cyst is related to thyroid gland. It comes through the duct, thyroglossal duct. So there are many things we are going to talk today, but the concept should be very clear to you. And the first 15 minutes would be a crucial understanding for your embryology for this part of the research session. First 15 minutes. So stay with me. How do we look like? How do we look like? What are the pharyngeal apparatus? That's what I'm going to explain to you step by step. But at the end, you should be able to understand what do you mean by bronchial sinuses, first arch syndrome, DiGeorge syndrome. These are big names, but in reality, it is very simple. It's just the big name is there. Thyroglossal cyst, and so on and so forth. Ectopic thyroid gland. So these are the major reasons. cleft lip and palate will be next resource session. So I will finish today up to thyroid gland. So all these things I'm going to talk today, and the next time, which is probably next week, I have a class on the palate, the face, cleft palate and the cleft lip. We talk about that, the face. It's all in your one single PowerPoint. The first part I'm trying to explain to you today. Second part will be done later, next week. So one more time, I'll start from here to here, and the last one will be next week. Now, what are the objectives we have? Describe pharyngeal arches. So let's start the ball rolling. Describe pharyngeal arches. What do you mean by arch? Arch is a elevation. Everybody knows what do you mean by arch, elevation, up. And when it is down, it is called pouch. So pharyngeal arch in the pharyngeal area, near the neck area, we call pharyngeal area. If it is a swelling part is there, you'll see that in how we look like, how do we look like? Or, we know how we look like. We go to the mirror every day, but it will open up your mind today. I'll make sure that it open up your mind. You will see in the mirror more closely now onwards, because we are describing pharyngeal arch. So arch is an elevation. When it is going down, is a pouch. We call pouch. We use this term, is a part of the apparatus, pharyngeal apparatus. And a groove. Groove is similar to pouch when it's outside. Like we have external ear, which is a groove, basically. We don't call pouch. Pouch is inside. Outside we groove, or we call sinuses. The pharyngeal membrane, you will learn that. What is the pharyngeal membrane? And this is the thing I want to show you, very simplistic way. How do we look like? First thing. If you don't believe this picture, then I request all of you to put your hand up and then scroll it down towards the ear. You put your hand up on both sides. You have two hands, so put your hand, and you'll see that something elevation or something now is going inside. That's the groove. When it is going inside is the groove. And then it comes up, so it is arch. So you have an arch over here, and then the groove. You have an arch over there, and then instead of groove, we call sinus. So when neck is a sinus. One more time. The arch is the elevation. The groove is the not elevation, is when it's going down, we call groove. If it is inside, we call pouch. The groove and the pouch are the same, or the sinuses. So anything outside going down, if the little hole is there, we call either groove or sinuses. Anything inside will be called pouch. But overall, this is an arch. This, how do you look like? You have seen yourself and you agree with this. You must agree with this, that we look like this. If somebody doesn't agree with me, that's what I said. Scroll your hand and you see that your hand or the finger is going somewhere, is external auditory meatus. That's the groove we have. So from an arch, going to the groove. From an arch, it is going to a groove, but here in the neck we call sinus. So what is a pouch? In order to see the pouch, you have to see inside. You don't see in the mirror, but that's exactly what we look like. You will not agree with me, so Dr. Paul, I look much better than this. You are a good-looking fellow, no question about that. I'm not challenging that. I am not challenging that. But agree with me that inside we have the complete arch. You saw the arch before from outside. You saw the arch from outside. You do not see inside. So now I'm showing you. You don't see in the mirror. So that is camouflaging you. You say, well, I don't see in mirror. I don't want to see like this. But trust me, you look like this. Or I look like this. Maybe you look like slightly better. But a concept should be clear right now. What is an arch? Arch is an elevation. So we have arch inside, we have arch outside. We have pouch inside, outside we have groove. This is the first arch. This is the first arch. Second and third arch are mixed together. You can see that. And then we have sinuses or the groove outside, and the pouch, we have pouch over here. we have pouch inside. So anything going inside, we call pouch, but that should be from inside, look. Anything outside, we call group. So external ear is a group. If you have auditory tube that is inside, a tube like that, that will be a pouch. That's a pouch. A pouch, here will be the tonsil maybe. That's in the pouch. Inside is called pouch. Outside is a group or sinuses. So our neck is a sinus. So now you understand, if we have sinuses, then something is going up, is an arch. So we have second, third arches like that. We have like this, 6 of them. We don't talk about number 5 and 6. We talk about up to 4. 1, 2, 3, 4 arch, 1, 2, 3, 4 pouch. You learn that. Each one is not empty like this. Each one is filled up with a bone or a cartilage or a blood vessel or muscle. So we'll ask in the exam, what are the muscles or the artery or the nerve or the cartilage for arch number 1, arch number 2, arch number. That's what we look like. You look much better because you have excellent muscles and the cartilage and the nerve and the artery. We have to know that. One more time, arch is the elevation, you can see. Groove is when it is going down like a hole. Inside we have a hole too, but we call pouch. Outside we call sinuses. Clear? Now, your textbook draw like this. Immediately the comparison comes, which one is best? I'll leave it up to you. Anyway, the book is nothing doing anything wrong, but exactly same way they are placing it. These structures are either a muscle or a nerve or an artery or a cartilage. Each one has. So first arch we have, second arch, and this is the sinus, cervical sinus. This is our neck. The narrow area is the cervical sinus. So we start with the 1, 2, it's showing over 3, 4 maybe, and the 5, 6 disappear. Now don't tell me that you never heard of these pharyngeal arches and the sinuses when you did the cardiovascular, CBP with me. I told you that aortic arch has 6 arteries, they go to each arch. So these are the arches we are talking about. The aortic arch is different from arch of the aorta. I told you 10 times. Aortic arch has 6 branches. One of them is arch of the aorta, but each one is going towards the pharyngeal arch. Arch number 1, 2, 3, 4 like this. I have the next diagram, we will see that later. And also have a different nerve, cranial nerve. Arch number 1 has 5th cranial nerve, which is obviously the trigeminal. Second arch has facial nerve. Glossopharyngeal is for the third. But the fourth is the vagus. We will be concentrating only up to 4. We don't talk about number 5, 6 because they join together and forming the neck. But we will be talking, your job is to make sure you understand number 1, 2, 3, 4. Arch and the pouch. First arch, first pouch. Second arch, second pouch. Third, third. Fourth, fourth. Over here. So 4 will be okay. 4 pouches, 4 arches. Remember, each arch has a nerve, an artery, and a muscle, and the cartilage. That is important for you to understand. So what are they? And the nerve is shown over here, so you know now we are talking about the 4 arches, and each arch has, the number 1 has 5th trigeminal. So you have the 5th upper part, you know the trigeminal nerve, and it has the 3 branches. Mostly it is sensory, except the mandibular one. It has, so ophthalmic, maxillary, mandibular. Ophthalmic and maxillary both are very sensory, and the mandibular has a sensory and the motor. But it's all together, and all these things are in the upper part of the face. This is the face. So if you don't understand, don't put this thing in perspective, think about this structure, my diagram. So anyway, at any rate, so your job is to understand these structures very well. That what is an arch, number 1, what is a group, what is a pouch, and what is a sinus outside, cervical sinus. Then there are nerves, artery, and the cartilage and the muscle. I will go through that, each one very well, but for the time being, you know already the cranial nerves for the arch number 1 will be trigeminal, number 2 would be the facial nerve, number 3 for the arch is the glossopharyngeal, and number 4 is the vagus nerve. We don't care about the number 5 and number 6. Good. This picture I showed you earlier, and that's what in the blue book is writing the correct thing. They want to emphasize 1, 2, 3, 4. I'm going to emphasize 1, 2, 3, 4 also. So this is an arch projecting out, and then it's going out inside. It's either a groove or a sinus. From inside is like this. These structures are from inside, which you don't see in the mirror. You don't see very much in there unless you open your mouth, but still you don't see too much on that. A little bit you can see the tonsil maybe. You do see in the mirror if you open your mouth. Is that okay? Very good. You have seen this diagram earlier. The aortic arch, first to 4, is called not arch of the aorta, it's the aortic arch. Remember, there are 6 branches we talked to you earlier. The first branch, first 2 are disappearing. And then third survives, and all that. Third gives a branch, and we are coming to that later. But the nerve is very clear. Number 5 for the 1, and then number 7 for the 2, and then number 9 glossopharyngeal for number 3, and for the 4th arch is the vagus nerve. This is the arterial supply, and you know why each artery is going separately, because we have aortic arch coming, and there are 6 arches over there. Cranial nerve for the same thing, 5, 7, 9, 10. So right now, I'm coming to that little bit. I put it over here so that you don't have to struggle a lot. What I said so far, I say arch, first number, we call mandibular arch. You also call it the mandibular arch. There are other names for this. It's called the mandibular arch. What is the nerve? Trigeminal nerve. What are the muscles? Muscles of mastication. You know that. It's all supplied by the trigeminal nerve. Mylohyoid, anterior belly of digastric, all coming from the mandibular branch. Tensor tympani, tensor veli, palatine, muscles of mastication. This is the part of the mandibular nerve. Now, skeletal portion is there. Obviously, the mandible is there, but it protrudes towards the ear, and you will learn very soon. I don't know whether you have learned it already, but you will be learning maybe next week, the malleus and incus. There are 2 small bones. There are 3 bones actually, malleus, incus, and stapes. Malleus and incus come from the first arch. So if the first arch is missing, if the baby is born with the missing first arch, then it will affect the ear also. The baby cannot hear. Baby will be deaf because malleus and incus is not produced. Second arch syndrome, you may have a problem with the stapes. There will be muscles of the facial expression, all supplied by the facial nerve. So you can say muscles of the facial expression, stapedius, stylohyoid, posterior bit of the digastric. All the muscles are coming from the second arch. So you have to remember second arch muscle. Basically, it is the facial nerve supplying the muscles. You know the stapedius is there, so the stapes is coming from the facial nerve. You have done the neuroscience. You are doing the head and neck. So if you still cannot remember, please remember now there is a muscle called stapedius attached to stapes. So it is supplied by the facial nerve. Styloid process, upper part of the body of the hyoid bone. So this is the bone. Here we are talking about the skeletal structure. So hyoid has 2 parts, upper part, lower part. Upper part of the bone is coming from the second arch. The lower part is coming from the third arch. You can see lower part of the body of the hyoid bone is from the third arch, and the glossopharyngeal, and remember this stylopharyngeal is the only muscle in the pharynx supplied by the glossopharyngeal. Rest all supplied by the vagus. Stylopharyngeus is an important muscle for the third arch. Fourth arch and sixth, think about only fourth, the superior laryngeal branch. So it is all vagus and cricothyroid and levator villi palatine, all constitute the pharynx and the larynx, all the muscles actually in the pharynx, except stylopharyngeus is supplied by the vagus nerve. And it is a thyroid cartilage, cricoid cartilage. And these are all the structures of the fourth to sixth arch. Remember thyroid cartilage, cricoid cartilage, that's good enough for you. These two cartilage for the fourth arch. So let's recapitulate what I'm saying so far. I'm trying to emphasize an objective that how the neck and the face area are developed, and it is developed from the pharyngeal apparatus. And apparatus means it is the pharyngeal arch, pharyngeal sinus, pharyngeal groove, or the pharyngeal sinuses. It is divided into six. We talk about four, fifth and sixth are joined together. So the first arch is also called the mandibular one. So the mandible is coming from the first arch, and the nerve supplying to the first arch is the cranial nerve number 5, which is the trigeminal, having 3 branches. And the muscles are muscles of mastication, mylohyoid, anterior biliary digastric, tensor tympani, tensor villi palatine. These are the motor muscles, or the muscle or the nerve supplying to the muscles. And the skeletal structure, apart from mandible, also the malleus and incus are involved. These are these 2 small bones present in the middle ear. Middle ear also has the stapes, but the first 2 bones, malleus and the incus, are coming from the first arch. So if there is a first arch problem, we call first arch syndrome, it will affect the malleus and incus. So in our exam, we may say first arch problem, you may think about trigeminal nerve, muscles of mastication, etc. You are not thinking about the skeletal structure also in the ear. So that can lead to a problem, what we call deafness. Similarly, second is the hyoid bone, the upper part. Nerve is the facial nerve. The muscles are the facial muscles, all the facial muscles of expression, stapedius, stylohyoid, posterior biliary digastric, they all come from the second arch of the facial nerve, supplying to these muscles. You know that posterior belly is digastric is the facial nerve. Anterior belly is the mandibular nerve, the motor component. And the skeletal component for the second one is the stapes, styloid process, and the most important, the upper part of the body of the hyoid bone. Upper hyoid bone, you should know what's the hyoid bone. See in the picture in the anatomy lab, you can see hyoid bone. The upper part comes from the second arch. The lower part comes from the third, which is particularly important for the glossopharyngeal nerve. And only one muscle is present in the third, and that's our target. Most of the time I ask that name the muscle coming from the third arch. Very important, because the only stylopharyngeal, this is the only muscle in the pharynx supplied by the glossopharyngeal. The rest of the muscles coming from the fourth arch and supplied by the vagus. You have to remember this, unfortunately. But I go back to this one. It's basically very easy for now. Beautiful picture showing you first arch. Look at these 2, malleus and incus. Second arch, upper part of the hyoid bone. All the facial nerve will be respond. All the facial nerve over here, and the facial muscles. So the second arch, more superficial, the deep one is the first arch muscles of mastication. They are present below the facial muscles. The third one is the lower part of this hyoid bone, and the only muscle responsible is the stylopharyngeus. From the styloid process over here up to this. There is a muscle over there. That's the only muscle supplied by the one nerve, and that name of the nerve is very simple, and we call that nerve as the glossopharyngeal nerve. And rest, the thyroid cartilage, cricoid cartilage is number 4, and the vagus nerve, and the muscles are muscles of the pharynx. All the muscles of the pharynx are supplied by the vagus nerve. It's very easy. So from this one, so you understand what is an arch, how do we look like, what is a groove, what is a sinus, this is the neck area, what is the pouch, this is the pouch number 1, pouch number 2, pouch number 3, and some structures come from the pouches, which I'll reveal right now in a second. I'll talk about the pouches a little bit now, because the arch, I completed that. The 4 arches, what are the structures coming out from there? The previous table will tell you everything. But now I'll come to the arch and the groove and the sinuses. What are the structures coming out from there? So this should be clear to you. Do by yourself, please. And this is by yourself, I explained to you. Now I come to the pouches a little bit, pharyngeal pouches. Remember, we have 4 pouches. Here it's showing 5, but we'll not talk about that. We'll talk about 1, 2, 3, 4 pouches. They are inside. You cannot see it. Groove is outside. And obviously, if there is a demarcation over here, that's the pharyngeal membrane. That's the pharyngeal membrane. So if I ask what is coming from pharyngeal membrane, you will see that our membrane in the external ear, tympanic membrane. The tympanic membrane is the answer for the pharyngeal membrane, because this is the tympanic membrane. Now you understand why the pharyngeal groove cannot go to the pharyngeal pouch, because there is a membrane over there. There are some structures over here. Similarly, some structures are coming from here. So auditory tube will be over here. This is the derivative of the first pouch. Let's see what are the derivatives of the pouch number 2, 3, and 4. So first pouch derivative is the auditory tube or pharyngeal pouch. Second one, please remember palatine tonsil. Palatine tonsil. Third one, thymus and the inferior parathyroid gland. This is the pouches I'm talking about, the derivatives. Thymus, and look at it, not superior. The inferior comes first. But when they go down, parathyroid gland, when it is behind the thyroid gland, you probably know that parathyroid gland is present behind the thyroid gland, then it takes the position inferiorly. But it comes from the third pharyngeal pouch, because the fourth pharyngeal pouch has the superior parathyroid gland. This is something you have to understand, the pouches, derivatives of this. We'll talk about only 4 pouches. Very important, very interesting, and you will not do any mistake, because I've gone through you step by step. I explained to you what is the arch, I explained to you what is the groove and sinuses, then I explained to you what is the pouch is going on right now, and then I say the derivatives of each one. If I say first arch, the derivative is already there. There will be muscle, there will be nerve, there will be artery, and there will be cartilage. You must know A to Z about that. First arch, second arch, third arch, fourth arch. Now I'm talking about the pouch. First pouch, and you know where it is placed, is the auditory tube. Second pouch, sorry, the first pouch is auditory tube, second pouch is the palatine tonsil. You have heard the name, palatine tonsil. You open your mouth, you can see palatine tonsil. You open your mouth, you cannot see the thymus or the inferior parathyroid gland. They are hidden. You cannot see the thymus gland. It is gone because it's for the child. Thymus gland, you cannot see it because it is present in the anterior mediastinum. It goes to the anterior mediastinum. And thymus gland is very important. So therefore, DiGeorge's syndrome is the problem of the third pharyngeal pouch. Make no mistake. If a baby, I will ask that question, what is the DiGeorge's syndrome? And you are alpha as a student, you said immediately, yes, Dr. Paul, we know more than you. And that is because the third pharyngeal pouch is forming thymus and inferior parathyroid gland. So the baby will have calcium problem and immunity problem. Period. It's so simple, because thymus gland is responsible, particularly in the child, infant, is the related to what we call as the immunity, and parathyroid gland is for the calcium. So if there is a third pouch problem, is the DiGeorge's syndrome. thymus, as well as inferior parathyroid gland. If it is a fourth pharyngeal pouch, then we have only the superior parathyroid gland, is only the calcium problem. But I don't think there is a disease only for fourth pharyngeal pouch, but there is a disease, a child could be born without the third pharyngeal pouch. Then the thymus and inferior parathyroid gland is gone. Derivatives of the pharyngeal group is the external acoustic meatus. Everybody knows this is not pharyngeal pouch. It is outside. Groove is outside. Pouch is the auditory tube. Derivative of the pharyngeal pouch, auditory tube. The derivative of the pharyngeal groove is the external acoustic meatus. When you scroll down your hand, the one finger goes inside. That is the external acoustic meatus. Second, third, and fourth group we call cervical sinus or the neck. So you can see, now you understand how we are born. We have arch, group, arch, sinus. Arch, group, outside. Arch, sinus. That's the neck. That's the reason the neck is so narrow. Derivative pharyngeal membrane has to be tympanic membrane. Very easy. Now, sometime I explain to this. This is another clinical situation is there. You can see that palatine tonsil, meaning that it is the second pouch, second pharyngeal pouch. Can you see that? The second, where the palatine tonsil is there. It's very close to the neck. So sometimes what happens is, if there is a pressure or there is some abscess or something, this comes out to the neck. And this is called external operation. Sometimes it comes as some fistula or swelling, we call bronchial pouch or the bronchial swelling. Remember, I showed you already bronchial fistula. If it is something coming out, bronchial fistula. Or a cyst, bronchial cyst could be there. If it is swelling, not coming out. But it is very close. The neck is very close to the pharyngeal number 2 pouch or number 3 pouch, very close. So anything can happen on the neck. If you're pressing the neck, you should not press the neck. But if you do that, you are very close to the pouch. What pouch we are talking about? Pharyngeal pouch. Number 2 is very. So that's why in case of there is a problem, internal fistula into the tonsillar sinus, it is related to the neck area we call bronchial fistula. And that's the bronchial cyst. So bronchial cyst could be over here. You can see that palatine tonsil because it's outside bronchial cyst. So I asked in the exam, what is a bronchial cyst? You will say that it is a swelling. Cyst is a swelling. The fluid is there. Why the fluid is there? It is connected to the second pharyngeal pouch. It's very close. So any problem with the pharyngeal pouch, second pharyngeal pouch, could be related to the swelling in the neck because it's very close, very approximate figure. Very good. And that's exactly showing over here. You see the sternocleidomastoid. If there is a swelling on this sternocleidomastoid, very likely it is the bronchial cyst. We may give this figure and we'll say, what is this? Don't say it is related to thyroid, because I'm coming to the thyroid in a minute. I have 10-15 minutes still there. I'll be talking about the thyroid gland. That is in the midline. That has nothing to do with the lateral part. This is the lateral part because everybody knows sternocleidomastoid muscle is in the lateral part. But it's swelling on this muscle or near the muscle, it has to be bronchial cyst. And why it is a cyst? Because it's very close to the second pharyngeal pouch. If there is a problem with the pouch, it will be translated into bronchial cyst. Now, development of the thyroid gland. So it's very easy. It is the first endocrine gland to develop in the embryo in the 4th week. You already know most of the organs are formed, or the glands are formed in the 4th week, except heart, which comes at the 3rd week. Very important is the first endocrine gland develops around thyroid diverticulum at the floor of the pharynx, where tongue develops. Tongue is in the midline. Just think about it. So thyroid gland comes from the tongue. You'll be thinking, oh my God, thyroid gland in the neck, how come? Because it descends, just like testis. It descends down, thyroid gland descends through a diverticulum. I'm going to show you that picture a little later. It's called the thyroglossal duct. The duct pulls the thyroid gland from the tongue to the neck area. So thyroid gland could be present. Some baby can be formed, can be not formed, can be born where the thyroid gland, little thyroid gland in the tongue, or maybe in the thyroid gland, in front of the thyroid gland, maybe in the middle of the neck, but in the midline only, in the midline, and can be in the proper position at the bottom of the neck, thyroid, where the thyroid gland should be present. But it starts from the tongue. Very important. As the embryo grows, the thyroid gland descends in the neck along the thyroglossal duct. So remember thyroglossal duct. Sometimes the duct could have a cyst. We call thyroglossal cyst. But the important part is thyroid gland comes from the tongue through the thyroglossal duct and descends, just like testis, I told you. Thyroid gland descends from the tongue in the midline. For a short time, the thyroid gland is connected to the tongue, foramen cecum, by the thyroglossal duct. So it comes from the foramen cecum. So let's see what I'm talking about. Now you can see the thyroid diverticulum in the tongue. This is the tongue in the midline. This is the foramen cecum. The thyroid gland starts over there and then comes in the midline over here, right, and then stops over here. How it comes, drags down because of the thyroglossal duct in the midline. Now you can see thyroid gland over here, and the arrow shows beautifully over here. So this is a very nice picture showing parathyroid gland. Look at this. The third pharyngeal pouch forming the inferior parathyroid gland. Look at that, where it is going. It is going inferiorly. The fourth pharyngeal pouch has superior parathyroid gland, which goes superiorly. So parathyroid gland goes inside the thyroid gland or attached to the thyroid gland. So when you remove the thyroid gland, actually parathyroid gland is also gone. You have to be careful. So 7/8 of the thyroid gland usually dissect. You keep the little bit thyroid gland because parathyroid gland is also present, superior to inferior. Otherwise, you'll have a calcium problem. This picture tells you 1,000 words in terms of, look at this. This is the first pharyngeal pouch. This is the first pharyngeal groove. This is the second pharyngeal pouch, palatine tonsil. And it is connected over here is the neck, which is the sinuses. This is the arch. That's the arch. This is the groove. Third pharyngeal pouch, fourth pharyngeal pouch. Here also the thymus gland comes. So if you have the picture ready, if you open my PowerPoint tonight, it should be absolutely clear to you. Sometimes it's showing that foramen cecum over here, the tongue, the thyroid gland is descending, but it stops. Ectopic thyroid gland along the thyroglossal cyst. It may stop over here, it may stop over here, it may stop over here. So it's showing you the thyroglossal duct, along the thyroglossal duct. So ectopic thyroid gland could be present in the tongue, below the tongue, in front of the hyoid bone, in the middle of the neck, along the thyroglossal duct. So this is the thyroglossal duct. Sometimes thyroglossal duct may have some cyst. That's what it's showing you. That the cyst could be over here, over here, over here. Thyroid gland comes along with that and present below the thyroid cartilage. There is a cyst. This is the thyroid cyst, thyroglossal cyst. It pulls the thyroid gland. So thyroid gland is placed, but it did not disappear. Some part, like if you think about urachal cyst, remember urachal cyst in the bladder, how it is connected to the umbilical, there could be some cyst because of the urine. Similarly, over here, the thyroid gland should be over here. It is here, but sometimes the thyroglossal duct does not disappear. Urachus does not disappear to median umbilical ligament. Similarly, over here, thyroglossal duct does not disappear. May have some cyst, we call thyroglossal cyst, but again, it's in the midline. If anything, by protruding the tongue, if it moves up and down, or swallowing, if it moves up and is related to the thyroid gland. Please make sure that you remember what I'm saying right now. Anything in the midline goes up and down by protruding the tongue or by swallowing. It has to be related to the thyroid. Either it is an ectopic thyroid gland, or it is a thyroid tumor, or we call hyperthyroidism, something like that, thyroid gland enlargement, hypertrophy of the thyroid gland, or thyroglossal cyst in the midline. But it has to move up or down with the protruding the tongue or swallowing. Over here. Remember thyroglossal cyst. There's a little baby thyroglossal cyst in the midline. Anything in the midline. Anything in the midline. Let me see whether you are sleeping or you are listening to me. I'll just give you one. It's almost finished right now with me. A 43-year-old woman is diagnosed with a condition that causes excruciating pain near her nose and mouth. Nose and mouth. It is likely that trigeminal nerve is involved in this. This nerve is derived from where? Such a easy question. It has to be first pharyngeal arch. You are right. Not a second, third, etc. We'll put this way. But only one student, you have like 225, 230 students maybe when you are year two student. I have in front of you 168 student, not bad. But one student who is present or who is absent will write something else. Will write second pharyngeal arch. He doesn't want to listen to me. Whatever he says, Dr. Paul, whatever you do, we are all fasting, everything, but I don't want to listen to you. What can I do? I said, thank you very much, my friend. Thank you very much, my friend. Let's see. First pharyngeal group gives rise to, remember, first pharyngeal group gives rise to, very good. Many people are answering it. It should be the external acoustic meatus. With this, because all of you are tired right now, I have taken exactly 50 minutes, close to 50 minutes, little less than that. I thank you very much, Ramadan Karim, and wish you all the best. I have to come back again to you next week. I hope you enjoyed it. It is not a rocket science. Just open my PowerPoint again. Thank you very much. And if you have more questions, I'll not entertain right now. I'm also a little bit tired today because I had a class in the morning, 9 o'clock for the year one. Then I had 2 hours of lab. Then I'm talking like this, couple of meetings. So I'll stop over here. But please feel free to send me email if you have any question. I'll respond to you as much as I can. I really love all of you and wish you all the best. Thank you. Bye.